So hi everyone, I'm Lisa from Australia. Thanks for staying until the end, like near the end of the section now. I would like to thank my two PhD supervisors, Professor Jane Stein-Parbury and Professor Lynette Chenoweth, for the support in this care support program for Chinese dementia caregivers in Northern Sydney area. And this is a schedule of my presentation today, divided into 4 parts. The first part on the background, and then the current study, followed by results, conclusion, and also recommendation. Now part 1, the background. I think we have already been listening to all these statistics in the past 3 days. Just would like to highlight, according to the World Health Organization, globally, the number of people suffering from dementia is increasing. And we know that it will be like increased by 3-fold in 2050. And there are like 140 million of caregivers' lives will be affected. And in Australia, dementia is now the 2nd leading cause of death. Last year is the 3rd cause of death, but this year has been jumped to the 2nd leading cause of death. So it's quite a concern, a health issue in Australia. And according to the Australian Bureau of Statistics, we have a lot of people coming from other countries, immigrate to Australia. I'm one of those. I was born in Hong Kong, and I stayed there for 10 years now to work and to stay with my son studying there. So we are coming from culturally and linguistically diverse background. My mother tongue is Cantonese, so English is my 2nd language. And a lot of people in Australia from the cold background can't speak English, so it's quite difficult for them to access to health. And according to the Australian Bureau of Statistics, we have 24% of people coming from cold background. And the same thing here by 2050, there's a 3-fold increase of number of dementia in this cold community. I'll use CODE to stand for culturally and linguistically diverse background in my presentation. And among all those coming from overseas, immigrate to Australia, 25% are Chinese. So my current study is focused on the Chinese dementia caregivers. And comparing to the mainstream caregivers, like the first language is English, the cold caregivers, according to a lot of literatures in the past 2 decades or past few decades, the psychological morbidity of these cold caregivers it's not good. They have more shame and guilt in their caring tasks. They have more caregiving burden, and many studies have already revealed that their depression scores are higher, and they have higher level of anxiety. So in general, people from the cold background, the carers for dementia, always have poor physical health. So as I have mentioned before, that one of the main reasons is the language barrier, but we have cultural barriers as well. In the cold community, try to confine the problems within their own family network. It's not only Chinese people, but also Italian and Greek people in Australia as well, Vietnamese and people coming from Asia as well. We try to solve the problem within our kinship system, within our family, instead of to get help from outsiders. We are trying to protect our family honor, not to disclose any bad news or negative news to the outsiders. And if we are going to seek help, there are shame and guilt involved in the help-seeking process. And it's quite difficult for us to access services if we can't speak English. And even though we can get the services may not be cultural specific. For example, I have a Japanese elderly lady who can't cook anymore because of dementia. There's no Japanese meals on wheels available. And somehow some elderly people are quite choosy. They would like to eat what they would like to have in their own culture. So it makes life a bit difficult for people living with dementia from the cold background. And that's why all the cold caregivers experience more difficulties than other, the mainstream caregivers. So on the other side, it is very important to support these caregivers in the cold community, because if we are not going to support them in the community, more or less the elderly people with dementia, the family members with dementia, need to admit into nursing home, and the quality of life will be greatly affected. So now, part 2 is the current study. The aim of the current study is to identify the perceived benefits and to provide support for the dementia caregivers in the Chinese community in Northern Sydney. Northern Sydney. So the method is in 2012 and 2013, I have conducted 3 weekly program. It is a carer coaching project from my supervisors. It's a project going to all the caregivers in the community. So the original project was all in English. So if you are interested in this carer coaching project, I'm happy to share all the menus, the facilitators menu, and also the participants menu to you. Just that it is a package like formulated by my supervisors, and they would like to share it with everyone who would like to give support to the caregivers in the community. So I have conducted 3 weekly programs. The project it's involved the education talks about dementia and how to manage the symptoms and behaviors, how to provide good health for yourself and for your care recipients, and the way to communicate with people with dementia, the services available in the community, and how to look after yourself and all this. So we would like to empower and support the caregivers in the community. So after this 3 weekly program, we are going to follow up all these people, and hoping that in the 2 years after they attended the teaching program, they can still use the techniques, and they can still have sharing and support within the group. And the monthly program has been running for over 2 years now, and it is facilitated by 2 bilingual Chinese health staff, including myself. We can speak Cantonese and Mandarin in the group, and we are the one translating the original English community carer project into written Chinese, and is verified by a professional translator. So we run this program with the partnership of Australian Chinese Community Association. They're really good in providing transport and providing a place in the daycare center, so that the people living with dementia can stay in the daycare center, and the carers can have time to have the carer support group next door. So it's quite comfortable for them, because they know that they're just next door. In case of any need, they can just go to the next room. And the ACCA also provided transport as well. So the qualitative data related to the content of all the group discussion is being collected, and we would like to know about the caregivers' experience in the program. NVivo, which is a software to organize qualitative data, is being used, and the content analysis has been using to derive the themes. So results. There are 6 themes emerged from these about 2 years of our monthly carer support program. And the results is there are 20 caregivers coming from the 3 community carer projects attended the monthly support group. You can see it's a big difference between male and female. It reflected in Chinese culture, most of the caregivers are female. So their place of birth including China, Hong Kong, Malaysia, Vietnam, and Indonesia. So all this group of people can either speak Mandarin and Cantonese. The age range of the caregivers is from 47 to 85. We have the 85-year-old lady looking after her 90-year-old husband at home. And her husband has already progressed to advanced stage of dementia. He has double incontinence, cannot speak anymore, and cannot walk anymore in wheelchair. Well, to be honest, if it is like a lot of cultures, the elderly people with dementia, 90-year-old, double incontinence, cannot talk, may be sent to nursing home already. But when the elderly wife joined the program, this is the first time that she stepped out of her house to get help. So you can see how they confine the problem within the family. And 60% of them are spouses, the rest are children, and nearly all of them are full-time caregivers in the community. Now you can see these are the words being mentioned during the group discussion. So the larger the font size, that means the more frequently these words are being mentioned. And I have put the colors according to the types of different words. The words in red are positive words or comments from the caregivers. It included able, breathing. Well, during the carer project, carer coaching project, we taught them deep breathing exercise and muscle relaxation exercise, and we required them to do it at least 2 or 3 times per week, and then to feedback to the group after practicing it and how they feel about it. And always during the group session as well, we always do deep breathing exercise and muscle relaxation exercise. I really like the presentation on the art therapy, having the small gift, giving let them have meditation and remember some good things. So we are using this technique as well in our group, asking them to tell us 3 very happy things in their lives associated with the people living with dementia. We try to bring back all the positive memories and try to make their caregiving task more meaningful. I really like that little gift. So, and then the words in black are the worries of the caregivers. And you can see it includes agitated, angry, behavior, burden, demanding, negatively, stress. So these are all the words mentioned by the caregivers during the group discussion. And the one in green are the services that they have been mentioning, and they're trying to get help from the outsiders. ACAT is Aged Care Assessment Team in Australia, which is a comprehensive assessment of elderly people, what services that the government is going to provide. And CATP as well, which is the community aged care package that we're offering to people living with dementia and over 65. And the blue one are the neutral words, and the amber color is the relationship. You can see that husband is the biggest one for all the amber words. Most of the caregivers are looking after their husband at home. But of course, we have daughter, mother, and wife as well. And 6 themes emerge from this group discussion. The first theme is sharing of information and helping each other. The caregivers, after they attended the weekly group section, education section, they have been discussing among themselves what strategies they can use in handle the behaviors. And they have really great ideas that we have never thought of before that they can share between each other. And they bring about all the information from the community talks, including the social security system, the new companion card that in Australia, if you're looking after people with disability or elderly people or with dementia, you can have a companion card that you can admit yourself into museums, opera, free of charge. So just one of the carers know about this, caregivers know about this companion card, and then they spread over to the whole group and telling each of them, come on, apply for it. It's really good, free of charge to admit into museums or operas or theaters. And they share the dementia care DVDs, a lot of information that they share with each other, and they have day trips together so that when one caregiver needs to go to the loo, need to go to washroom, the other carers can look after their people, their families are living with dementia. It is a very good self-help group that they are forming. The second theme is eagerness to help, to seek help. As I have told you before, that most of the caregivers in Chinese culture try to confine their problem to protect their family honor. But after this program, they started to ring helplines and getting services everywhere that include respite service. We have in-home respite service in Australia that people, just like babysitter coming to your home, but instead, sitting for a baby, it's sitting for people with dementia, that they can apply for this service. And they will also apply for residential service as well. In Australia, we can have 63 days of residential respite service provided by the government free of charge if you apply for it. So it's really good for the carers, especially the caregivers, like for example, they would like to go for a holiday, or if they would like to go back to their own country to have a short trip, so the elderly people, their family members with dementia can be admitted into these respite services. They have an increased use of dementia daycare center and also all the Chinese meals on wheels. So in Northern Sydney is the only local health district that provide Chinese meals on wheels, which is really great because as I have mentioned, like the Japanese lady doesn't want to have Western meals, but she would like to have Japanese meals. It's the same in different cultures, especially when they're getting old, and especially when they have dementia, they can only remember the taste in the early life. So having their own meals will be really great. Now the third theme is caregivers looking after their own health. As I have mentioned before, that the carer coaching project, we ask them, we empower them to look after themselves, and they start doing more exercise. And one of the they have a lot of homework. Every week, the homework is every week. The first week is just deep breathing, relaxation. Second week, muscle relaxation. Third week, going for a walk. And then the fourth week, doing some healthcare thing for themselves and then for their families with dementia. So because of this program, they continue what we have taught them during the weekly sections, and then they carry on the exercise, they carry on the healthy diet. Some of them start to reduce body weight. Most of them are more relaxed, and some of them have better rest and sleep. And at least one of the carers who refused to see the doctor herself, which is an old lady, started to do the body health check, and it's really good for the whole group of caregivers encourage each other. Because as healthcare professionals, I'm a clinical nurse consultant in Northern Sydney. Sometimes my words or our words are not as powerful as the caregivers who are like in the same boat. They have increased number of social gathering. One of the elderly men who looked after his wife with dementia started to look for friends that he didn't visit or didn't see for a long, long time. He eventually managed to contact his high school mates 50 years ago, and then they have a gathering. And he was really happy sharing it with other caregivers, that encourage other caregivers to get in touch with those good friends or to engage in some activities that they would like to go for. And the fourth theme is acceptance and confidence in the caring task. One of the sections is about person-centered approach. So they are more about stigma as well. They're more confident to tell the shopkeepers, like in the shopping center, telling them that, my wife has dementia. If she wandered into your place, please keep her, I will come back. Because this is the place, it's a food store. I think many women like us, if we need to buy food for the dinner or for lunch, we always choose the fruits and pick up going to the market. So the husband is more willing to tell the shopkeepers that my wife has dementia. If she came here, just let her stay, or if she would like to take fruits away, I will pay for it. So it's very good that they are like confident enough to expose their family members with dementia. Some of the caregivers blame the other family members not helping them, but at the end of the program, they told me that they're the best person to look after them because they are like getting more knowledge and skill in handling this. And they have they managed to identify triggers to the behavior, and they're able to minimize aggressive behavior or behaviors of concern. And as I have mentioned before, they accept behaviors with less stigma. So the last two themes is developing person-centered caring skills. We have been teaching person-centered skills and care to the caregivers. And now they understand the needs-driven behaviors. Instead of stopping the screaming behavior, they understand that the screaming, behind the screaming is some needs that are not being met by the environment, by others. That's why he or she scream. So we help them to understand the behavior instead of stopping them not to scream. And the caregivers allow care recipients to help in house chores, even though one of the elderly lady told me that, my husband can never wash the plates properly, it's so dirty. Then, but after this program, she's willing to let her husband clean it, even though it is not good enough, that she has to do it again. But at least the husband enjoyed the time that he can help in the house chores, because he understands that he's no more helpful in the family, and he doesn't want to be the one very dependent and rely on others. And the caregivers started to offer choices and autonomy to the care recipients, and they have better communication skills after the section on how to talk to your family with dementia. And the last theme coming out from the caregiver support program is positive thinking and psychological empowerment. So the caregivers appreciate the contribution of the care recipient, even though their family with dementia cannot manage to do the house chores properly, but at least they have the intention to help. They also appreciate their own achievement as well as their own strength, and appreciate other family members. And they are more relaxed and less stressful at the end of the program. Now the conclusion and recommendation. So the conclusion is the caregivers have perceived a lot of benefits from the carer coaching project and the follow-up program, the monthly carer program. And they have gained mutual support from each other, and they have better confidence in their caring tasks. Seems like they're professional now, and we are just facilitators, and they're the one teaching each other. And they have better knowledge and skills in the person-centered care. They have look after themselves better and look after their family with dementia better, and they have more positive thinking. One of the reasons is one of the caregivers during these 2 years of the support program, her husband died suddenly because of stroke. So she came back to the carer support program, telling other caregivers saying that if you can still hear his voice or her voice, if you can still see them smiling, it's really worthwhile to stay with them and look after them. Oh, she was really sad, crying a lot, but then other caregivers are supporting her, and she's supporting other caregivers as well. So we have really good group, self-help group together. And they have increased help-seeking behavior. They started to get all the services and telling us as well what are the services available. So it's a really positive and very promising program to carry on. So the recommendation is it is very important to support all these silent community caregivers in the community. Try to minimize the admission into nursing homes. And the New South Wales Health in Australia will continue to work in partnership with all the community organizations, and we're trying our best to promote the mental health and also the quality of life of our people living with dementia and also their caregivers. Now, I have timed my presentation last night for a couple of times. It's less than 15 minutes. These are the references for the care support program, and you're really welcome to get in touch with me after this presentation. The number 4 references, the fourth one is the education program for the carers for people living with dementia in the community. So I'm more than happy to send you the information if you are interested in this 6 weekly carer program. It have all the menus in it. So time's up, and thank you very much for listening.